Bella, I said Bella has to go at 10 to 2, so I thought we might take some questions. If there are any questions specifically for her, so we'll take them now, and then we'll have the two speakers. I hope you find that agreeable. There's one there, and there's one here. Yes, take it. Who are you, please? There's a mic. I think there's a roving mic, so bellow into that.
Hello. Hello. Yeah.
Hello.
Raffaella Bellanca from Head on Household Energy Network. My question is obviously around energy. I was interested to know what these others areas you didn't mention, if by any chance there is anything related to energy. Also because of your focus on malaria, which is obviously very important, but cooking with open fire stoves actually kills more people per year than malaria. So it is in our eyes a very important issue, and the energy is actually behind basically any of the MDGs. You can't have address hunger without agriculture, which is strictly related to energy, and water is the same thing, and so forth.
Okay, great, excellent. There's a lady over there, front row, I think. Is anybody else who's got a question for Bella? There's a gentleman there. You can take.
Sarah Maguire from excuse me, from Social Development Direct. Really happy to hear what DFID's direction is going in, and I think we're probably all a bit relieved since recent events. I'm particularly relieved because excuse me, this is beginning to sound like the human rights-based approach by stealth. That actually what we're talking about here are the issues that the human rights community have been banging on about for some time, about indivisibility, about not accepting that it's okay for a country to say, well, we've reached our MDG, but, or rather we ignore the fact that X% are missing from those numbers. Very interested in what you were saying about the moral imperative there, and when you say about a child being born unequal, of course, the UDHR says all human beings are born equal. So I'm sort of very interested in that, but I do wonder from that whether DFID itself is acknowledging that this is in a way the human rights-based approach by stealth, or whether it's trying to say, forget human rights. We're actually not interested now in a human rights-based approach. What we're doing is calling it something else and calling it equity.
Okay, excellent. There's a gentleman there, and we'll take two more, and then that'll take the fight.
Neville Grant, United Nations Association. No one's going to disagree with the focus on primary education, but the MDGs will be delivered not by DFID or USAID or UNICEF. It's going to be delivered by local professionals on the spot. I'm very concerned that the insufficient emphasis on training local professionals at secondary and indeed tertiary level in order to deliver the MDGs.
Okay, thank you. There's a lady here, and there's a gentleman there. I'm going to take those ones.
Rachel Jones, Health Palm, a charity that works mostly in the former Soviet Union. I was very interested in Claire's comments that...
Claire's questions can come later.
No, it's not a question to Claire, it's a question to Bella on the basis of Claire. That the majority of the poor now live in middle-income countries, because we are faced with the situation that we see enormous poverty, and we work in the health field, in these countries of the former Soviet Union, but development funding has largely dried up because they are middle-income countries. And so I'm very interested to know what you think the government's approach might be to dealing with help for the poor in middle-income countries.
Okay, good question. There's a gentleman back there, I think. We'll see how we go with these ones, and then we'll see if there's time.
This one?
Yeah, as quickly as you can, please.
Toby Quantrill from the Fair Trade Foundation. Just a question really to do with the success stories. Is there any examples that we're aware of where income, equality, and I suppose I'm instinctively thinking about income inequality, has been significantly reversed over a period of time? And I ask that in light of the last 13 years' experience in this country.
Okay. 5 questions there. Bella, for you.
Okay.
Energy, human rights approach by stealth. How do you train local professionals? What do you do about middle-income countries where there's lots of poor people? And are there any examples of income inequality being reversed?
Okay.
We'll start for 10.
Fine.
You have 1
Okay.
minute.
Thank you. Well, I'm going to start by passing the final question on to my colleagues, who I think will probably be able to answer it more I could make a suggestion, but it probably won't be as accurate as the answer they could provide. And then I'll go back to the first, energy. To be perfectly honest, energy isn't one of those real central policy areas for us, but it does come into the equation quite importantly. You know, we're a very centralised institution in DFID, and for the money that goes through our bilateral programme, decisions are made based on the analysis of what happens in country and what the needs are in country, and there energy crops up occasionally, but doesn't tend to be one of the things that we focus a lot of our resources on. It tends to be, we tend to look to other international development institutions to do that. We look at the World Bank and the other international financial institutions for heavy, large-scale investments in energy. We used to do it, but we moved into other areas, so we don't do that so much. But through community-based programming, we do a lot of things around household fuels and those kinds of energy issues. What I would say, though, is that climate change is a big area for us. And even though it wasn't in the top 5, because it's still, the 5 areas I mentioned, it's still really evolving what the approach of new ministers will be on climate change. It will continue to be central for us, and their energy is an absolutely central issue. So I hope that's a satisfactory answer. On the human rights approach, I would say that I'm not sure that you could say that DFID is taking a human rights approach right now. I think that as policy evolves, we will see questions of equity being raised and discussed, and I think the evidence that you can bring to that discussion is really important in terms of shaping policy and practice going forwards. But human rights a human rights-based approach is not necessarily one that's being talked about at the moment. So, to be perfectly honest, but that doesn't mean that issues around equity and shouldn't be a central part of policy thinking. The UN Association question on secondary and tertiary education, again, sorry, I'm not going to be very satisfactory on this. Our education policy is emerging, but I can definitely see in the discussion that when we've moved on a bit from primary, and we've recognised that secondary and tertiary are perhaps areas of education where we haven't given so much attention, but I couldn't say anything further really on that at this point in time. And on middle-income countries, I think that this data is really interesting and very challenging for us in the international community. I think it's just emerging. I think we haven't discussed it even yet internally in DFID, but I think it will provide some very interesting, the fodder for some very interesting discussions. We're actually going through a process of what we call the bilateral aid review at the moment in DFID, where we're looking at all the programs in our countries, everyone from middle income, which we have very few, as you probably know, to low income and fragile and conflict affected, and we'll be looking there, I think, at the totality of what we're doing bilaterally, and I think these questions will start to be asked. But a very important analysis, which we will be looking at. Thanks.
Someone sent in a question by email, which I'll put, which is UNCTAD observed that the ODA to agriculture has been decreasing as that for governance increases. Will this trend continue in the emerging agenda from DFID? That's from Veronica from CPSU. And there was a couple more questions there. I think we'll have to go on to our other speakers if we're waiting patiently. There's a lady there, lady at the back, and that's going to be it, I think. Okay. Let's see how we go.
Yeah.
Hi, I'm Margaret, just a member of ODI. You mentioned one of the focus was fragile states, and you also mentioned that a lot of the very poorest are found in those states. Now, with DFID's budget under review by the National Defense, how will countries that are not fragile states but are still low in resources, low income, be able to meet their MDGs? Okay. Will DFID be able to focus funding on them as well?
Okay. Over there.
Thank you. Kate Erdley from World Vision. Just talking about a real-world example of equity, user fees for health. They've been recognised as the most regressive form of health financing by many agencies, including DFID, WHO, UNICEF. And DFID have done a really good job on this, championing the removal of user fees for health. And we're slightly concerned that this championing role is being put on the back burner within DFID. So I was just concerned about this kind of real-world example of equity, how DFID are going to take this forward and really continue this.
Okay. Right, if you can do it in 10 seconds. You can. Okay.
A few years ago...
Hang on, wait for the mic.
10 seconds and
8 seconds.
A few years ago, Bella...
Who are you, sir?
Tom Levitt.
Oh.
I was Hilary Benn's parliamentary private secretary a few years ago.
Yeah.
A few years ago, as I recall, DFID pulled its emphasis away from middle-income countries, partly because everybody else was funding middle-income countries, and therefore it was important to put our aid where it was going to be most effective. From what you've just said, where you say the door might be open to going back to the funding middle-income countries, will you be sure that that is done in the knowledge of what other people are doing and what the total amount of aid and development assistance is going to those countries?
Okay. Bella,
Yeah,
you take
okay.
those. Well, that's you've done your stint there.
Then I've
right?
done my stint. Then you'll let me go. Okay. I can't give you very satisfactory answers on many of these. So again, apologies. Ask me back in 6 to 12 months' time, and things will be a lot clearer.
There were 4. There was agriculture, fragile states, wasn't there? User fees, and are we doing what we're doing with the knowledge of what others are doing?
Yes, I wanted to get a little bit more clarity on the question on fragile states. Actually, could you?
We could be cutting funding to other low-income countries.
Okay.
If we do not consider fragile.
So the opportunity
Okay.
cost of focusing
Yeah.
on fragile states is that you don't spend so much on less fragile
Yeah.
states.
Okay, agriculture, I think the jury's out. Recognition that it's really important. I don't know yet until we've looked at the totality of what our countries are programming as to whether this is going up or down, but it's definitely in the picture. On fragile states versus non-fragile low-income countries, again, I think we're going to have to we'll see what the outcome of our bilateral aid review is going to be as to where the balance of money goes. But you know that DFID's overall resources are growing dramatically, so I think there is money to allocate. So we're in a good position to share the money around. But I think those decisions are going to be made over the next few months. User fees for health. Yes, we have been championing that in recent years. Again, this is part of the health discussion which is yet to be had. But I think what's important is that we look hard at the evidence base for the impact of these policies and use it as a basis for a discussion going forward. And I think on the last question on total aid, yes, of course, as allocations are made, we need to make the decisions on where we allocate in relation to where others do. It would not be sensible to do otherwise, and I think that's definitely what will be part of our decision making going forward.
Okay.
Thanks.
Well, thank you very much indeed for that. Thank you. There'll be more time for questions at the end. Thank you to our other 2 speakers for being so patient. I think it was
Thank
probably
you.
right for you to have your say before you dash off.
Thanks to
Bon
everybody.
voyage. Who wants to go first? Richard?